There are very many causes of mental illness, and we may not be able to pin on exactly why one person has got the mental illness. But one thing I know is that there is somebody is born with a tendency to get certain types of mental illness. But usually there are other conditions in the environment which usually tip off the person to actually get the illness. So some of these problems could be stress. It can be due to biological causes like injury to the brain. It can be due to drugs. Some people take alcohol and drugs get the disease. And it can be just other usual struggles of life. So you cannot say that it is over an infection or they ate food and they got, or it is witchcraft, but it is because you have a tendency of developing certain brain, because there are some genetic, characteristics which we inherit from our parents, maybe in your brain structure, maybe in your emotional response. And when there is enough environmental trigger, as I said, like stress, like alcohol, like drugs, like injury, like infection by maybe some other brain diseases, then the person gets a mental illness. But it's very hard for any individual person to know exactly what caused the illness to come. Because even in conditions of trauma, like you lose your property, you lose your relatives, you go into a situation where you are tortured, where you suffer, all of this can push a person who has that tendency into getting mental illness. Like especially like in the situations of war and conflict, we have seen many people who had not broken down actually break down because of that war, that they're suffering from the war effects. The first thing we need to do to avoid some of those problems is we need to look at the parenting and the social support a person has. Somebody, I said, the cause, the tendency, or the genetic predisposition, you are born with it. But we need that right from childhood. The parenting style, is a child being supported? Are they given love? Are they, are they happy in the environment in which they are? Because if children are neglected or they are not parented properly, then it affects their future life. And then, of course, if it is like alcohol and drugs, the important thing is for people to know that when you take alcohol or drugs, these are substances which affect the brain. So because they affect the brain, they interfere with the normal functioning of the chemicals in the brain, which usually transmit messages. And when they interfere, a person may get mental illness. In some cases, the brain structure of the person is in such a way that it gives off either too much of these chemicals or too little. And those with too little may get depression, those with too much may now go the other side of the excitement. So, in such a case, we can only detect early that when the person has the first symptoms of behaving with different symptoms which we know, to treat them early so that you don't let the problem grow and therefore affect their whole life or become even more difficult to treat. So early diagnosis and management is also very important in preventing the serious mental illnesses. Of course, the schools where children go, if they are bullied, avoiding war and conflict is also important. So if we can intervene at those levels, we can reduce much the number of people with mental illnesses. And social support, family support. And that's why it is important that we as Africans should keep to our method of the extended family supporting the person. Because people who are stressed, who have a tendency for mental illness, once they get stressed and there is no help and there is no social support, then the balance is tipped and they actually break down. So we need to keep our communal kind of support life, because it helps to prevent people from breaking down, and those who break down to be able to recover and recover their full functioning because of a suitable and hospitable environment. No, mental illness cannot be transmitted because it is not a bug. It is not a bacteria, it is not a virus, it is not a fungus, it is not an organism that can be transmitted. So except maybe if the blood transfusion gave you HIV, because you know HIV also can affect the brain and cause mental illness. And also if you suffer HIV, it causes certain stresses because it affects the whole social life. Maybe if you are not married, you may not marry. If you are married, your marriage may break down, or you may produce a child with HIV. And people, because of the stigma attached, some people actually break down from suffering HIV. But also, you know, HIV, if it is not treated early, the HIV virus can actually affect the brain directly and cause diseases like dementia, cause also other mental illnesses. So apart from that, the other mental illnesses cannot be transmitted in blood transfusion. I think it is very dangerous to use both because, first of all, the traditional methods, if they are giving you like herbs or drugs, these herbs have chemicals in them. And many of them we don't know exactly what is in the herbs. The dosages, how much you should drink, whether it is a glass or kadomora or what, is not known. And the side effects of those chemicals which are there are not known. So if you add in the modern medicines, which are also chemicals, which have side effects, although we know them, then either you take an overdose or the side effects will interact, and in the end it will be dangerous to you. Then finally you will not know what made you well. So you have a double expenditure of money because you are paying for the traditional medicine and you are also paying for the modern medicine. I would encourage the users to use the modern medicines because they have been studied. A lot of research has gone into them. We know what they contain. We know what they do when they go to somebody's brain. We know how much you should give, and we know their side effects. So when they come, we can treat them. So I would encourage them to use what is known. If at a later date, maybe some years to come, somebody does research on the traditional medicines and find that they are working, then at that time somebody will have a choice of whether using traditional or moving to the modern. But as of now, the only medicine we are comfortable with as professionals is the modern medicine, and we have a very good spectrum. Some of the older drugs are still very good. We have some new drugs. If you cannot stand the older drugs, really we have a lot. It is not like before 1950 when we had no medicine. At that time people were using traditional. But after the discovery of Ragactil, and many more medicines have been discovered, and they are continuing to be discovered, I don't think somebody should waste time taking drugs they don't know what the consequences will be. It depends on the condition which is being treated. Some conditions, such as depression, you can get treatment, and when you have recovered and you are fully recovered, you may be taken off medicines and you may not relapse. Because especially if it's just depression on its own, which is not bipolar, many times after we have given treatment like for 6 months, then we may say don't take medicines. But when you feel some other symptoms coming, then you can come back. Some people get transient psychotic conditions, and when they are treated, they get well, and actually they may live their life without ever getting it. But some conditions like schizophrenia, these are the serious, complicated mental illnesses. We recommend that even when you have recovered, then you may stay on a small dose to keep you going, so that you do not relapse. Also, like some of the conditions of excitement, the mood disorders like mania, we usually put people on a low dose of what we call a mood stabilizer to keep them calm. It protects them from getting the relapses. So the professional treating you, who knows the different mental illnesses in their nature will know whether you should continue medicine or not. But we advise that you don't win yourself from medicine on your own. There must be a consultation with your doctor. You go and tell them how you are feeling, if you are completely feeling fine, and depending on the type of illness you have, they may give you a holiday from medicine. But still you need to be in a contact so that you make sure the condition does not relapse. Because you may never know when it relapses, where it will find you. So that you may get lost, people may beat you up, thinking you are a thief or what. You may be abused, so you may wander away and get lost. So unless the doctor has put you on the drug holiday, you don't stop. And it is important to have an understanding. Explain to your doctor what you feel. If you are tired of the medicines, explain. They can reduce, or if they think you still, if you still need, they can reduce the dose so that you're on a smaller dose which doesn't disturb you. And if they think you are completely recovered and can manage, and you have a good social support system, relatives and family are supporting you so that when you break down, they can bring you back. In such cases, they can put you off the medicines. Most of the discrimination and stigma arises from ignorance. Many people do not know the causes of mental illness. And traditionally, they have got their own explanatory model of what causes mental illness. From witchcraft to curses to demons to failing to appease the ancestors and such things. Now, because they don't know, they think maybe if they relate with you, it may also go to them. They don't know, they don't understand. And many of them believe that people with mental illness are very dangerous people. They are unstable. You cannot trust them. So if you bring them, let's say you work with them, they are going to break down, they are going to break all the computers and all this furniture and what, they are going to beat up people. So that ignorance is the one which has created a lot of discrimination and stigma. So it is important that we as professionals and also the users educate the community to know that mental illness is an illness like any other. And it is not, research has shown, it is not only people with mental illness who are, in fact, the so-called normal are more violent. When you look at the murders, the defilement, the rape, the robberies, the people who call themselves normal and who come to examine them and they're actually normal are doing more crimes than people with mental illness. I would say people who are quite maybe violent many times are people who are using drugs. But most of our traditional mental illnesses, those people are really harmless. Many of them are living in their own world and they're not even concerned about the people around them. So that misunderstanding and ignorance and the explanatory model of curses or what is the one which makes people stigmatize and discriminate people with mental illness. The reason it was stigmatized is because people felt there was no cure. It is another reason. Because when you have a condition which can cause somebody to lose touch with reality, which can cause somebody maybe to undress or put on drugs, misbehave in a bizarre manner, in an inappropriate manner. So, and they think there is no treatment, it cannot get better. So people try to hide their head in the sand. Actually, the Bible says, forgive them, they don't know what they are doing. It's because they don't know. They fear. The fear of the mental illness, how to deal with it, is the one which causes them to stigmatize. Everything which is feared is stigmatized. And you can remember when HIV had just come and there was no treatment. People were fearing people with HIV. They would not want even to sit with them or eat with them. But now when they know that there is a treatment, you find people with HIV almost like privileged people. People even go and marry them when they know that they have HIV. So it is that fear of not knowing mental illness, its cause, what happens, is there anything which can be done. So writing off the people who have mental illness is the one which causes the stigma. Not understanding that actually it can be treated and these people can be normal. But it is fear and ignorance. The important thing is treatment. So if you discover you have a mental problem, do not go into denial. Get treatment as early as possible, because if mental illness is treated early, you can recover. Even if they put you on some medicines, you can recover and get your education and be able to get a professional job. Of course, this involves educating the family to understand that this person, because they have got mental illness, it is not the end of the world. Majority of the conditions, the people do not lose their intelligence. They remain intelligent and they can actually study. And I have met professors when I go in my international work, professors, big people who are actually having mental illness, but who had it when they were still in school, but they persevered and they qualified and they are doing very well. So you need to ensure you get a good education, but you also need to educate families, not stop children who have mental illness from continuing with school. The only thing is you get treatment. And as I said, currently we have very good medicines which can even be taken by a student and not feel very sleepy and very weak. They are a bit expensive, but they serve the purpose. The person can take them and be able to attend school. I have my own patients whom I've treated when I was in Butavika, where I was for 12 years. I am seeing adult people whom I treated at that time, who were young people, adolescents, when they started breaking down. And they have studied and they're holding very good jobs and taking care of themselves and other people. Yes, the most gratifying experience of my life was when I worked in Butavika. There's nothing which makes a health worker happy to see a patient who was brought on ropes or who was being tied by big men and who even maybe refused their first injection, being treated, recovering, and coming on their own when they are smartly dressed and explaining to you and going back to work. I think it is the most gratifying experience I've ever had. And no wonder I've remained to be a passionate advocate of mental health, because treating malaria, delivering a woman, you cannot compare this, because in mental health you deal with the whole person, because the mind controls the person. So when you deal with somebody's mind and you treat him and is able to make the right decisions, I am happy when I see those who have married and they now have children. So I think I would be happy to take them with me, because I am an advocate for mental health, and I am not ashamed to tell people I worked in a mental hospital, because it made me what I am. It made me a better person. To overcome the increase in mental illnesses is a very, very complex and costly enterprise, a costly exercise, because mental health is affected by a lot of what goes on in the environment. As I said, you need to deal with the alcohol and drugs, because I think there's a big number who have come on board with the mental illness because of alcohol and drugs. So as mental health, for us, we are crying that the laws for alcohol and drugs should be implemented. But although other people have an idea, they don't take it seriously. It is not well funded. So you find that even if you wanted to educate people and put controls in place, as a sector's health, we find we are struggling on our own. If people knew that avoiding conflict and war will protect a big number of people from getting mental health problems, then they would not even start it. But the people involved in war never stop to think that what will be in the aftermath of this war? What are the consequences of this insurgency? They are looking at their own selfish gains, but they are not looking at what happens to the people around who are being trampled on by whatever is happening. If people knew, I tell people, if people knew that if you do good immunization of your children, then you'd avoid some of the brain diseases, the infections which can injure the brain and it can cause mental illness. that would work. But you talk to people, but some people still refuse to get the immunization. In the Kampala here, if people knew that going on a border without a helmet puts you at risk of a head injury, and head injury could actually enter in a mental health problem, everybody would be using helmet, including the riders and the people who drive them. But it needs a massive education program and a massive enforcement program. And this education should be right from the parents to families to community to leaders. But unfortunately, the international community doesn't help much, because when they give us funds, they skew them towards communicable diseases, HIV, TB, malaria, and maybe reproductive health. And they forget that even those TB, the malaria, the reproductive health, women who get pregnant, get mental illness, also add on the burden. And in those programs, many of them are not incorporating mental health. It has been a big struggle trying to convince them, but it is rare that they actually will focus on mental health. So we still have a long way to go, because we have to bring everybody on board. As a government, first of all, the thing we need to do is to ensure that we provide services, because that is completely in our mandate. Make sure people can access services, including medicine, but also other types of care, psychological care, at the nearest health facility, and by whoever is the health worker there. It's an exercise we have embarked on. We have not covered the whole country, but it will continue until we make sure that every health facility can help somebody with a mental illness. If they cannot treat them, at least refer them to the next level where services are. Then the prevention aspects, we need to continue educating people more and more. First of all, to protect them from getting the diseases, but also to not sit early. You know, people breakdown, get mental illness, they keep hiding around and do not bring them out for full care. But then the final thing we need to do is to give the users a voice. We saw in HIV program, when the people with HIV were given a voice, they were able to impact the government, to budget for them, to provide facilities, even to get international bilateral financing. So we need to give the people, even with the users, a voice, so that they can speak from the horse's mouth, so to say, and inform government, inform their local leaders, inform their local health managers about their condition and the need to prioritize it. Then finally, we need to have a law, which is now we have a law in Parliament, which we hope will be discussed when the politicking is all over. With this law, which is going to protect users from the discrimination we have talked about, from the stigma, so that if you do anything to somebody with mental illness, you can even attract a prison sentence, you can attract a fine. So with that law, once it passes out, it will support us a lot in ensuring that the rights of the users are protected. Of course, Uganda is one of the low-income countries. So we get a lot of bilateral aid from the developed countries. But the challenge is that these developed countries sometimes have an interest in other conditions where they can see their gains very fast. So many of them are reluctant to actually fund mental health programs. So government needs to put them to task to make sure that they also fund programs like mental health. But unfortunately, in some cases where even the bilateral donors are interested, for example, I understand PEPFAR, which is an American fund, is interested in including mental health in the HIV/AIDS programs. But the local HIV/AIDS program managers, when they ask them their priorities, they never put it. So if they don't put it, the American government cannot start doing what? Thinking for the government must prioritize it. It is prioritized on paper, in the strategic plan, in the policy. But when it comes to funding, financing, it is not so prioritized. First of all, the population is increasing, so the illnesses will also increase as the population increases. And again, there is breakdown of the social structure. So more people taking drugs, more people taking alcohol. The support system, I said, if you're vulnerable, if you have a tendency and you don't have a good family support system, you are likely to break down. There is a big breakdown in the family systems. People are individualistic. So you find somebody has problems, they have nobody to discuss with and to help them solve it. And with advancement and increasing of the gap between the rich and the poor, people are striving so hard to try and catch up. And in their striving, some get debt, others fail, others get caught up in crimes and so on. So all this leads to increase in mental illnesses. A case in point for Kampala, we have a lot of urbanization happening. Somebody sells their land in the village, comes to buy a boda and live in Kampala. And the money they make is not enough. And then one day the boda is stolen. So, and he has nothing, he has no land anymore, and he's there here in the slum because that's what he can afford. So the poorest person to me is the person who lives in the urban poor. So many of them again degenerate now into drugs and alcohol, and that leads to an increase in mental problems. So urbanization, the gaps between rich and poor, the wars, there's a lot of wars happening, terrorism, whatever, all this increase the rate at which mental illnesses develop. And the population itself, we have some places who have what we call a population explosion. So with a big population, then you have more numbers of poor mental illness. Even, for example, can you imagine in Kampala now a child cannot find any ground where they can play football? No recreation. The social services are not enough. So if somebody is stressed, you have nowhere you can have recreation without paying, and yet you don't have the money. So all those increase the mental illnesses. The problem challenge we have as headquarters is that the services are decentralized. So the hospitals order their own medicines, and health facilities order their own, except for the lower ones. Now, historically, mental illnesses were not being treated in primary care, for example. Now that they have started, we need to quantify anew the mental health medicines needed so that national medical stores can be able to import enough. But even if they import, when a hospital or health facility is given money for medicines, it is them to request the right amounts. But it depends now on the health manager whether they involve the mental health workers in quantifying what they need for the next quarter, or whether even the health workers put it and it is cancelled. So we still have a lot of work to do at the managerial level. In some cases also, most cases, it is not only mental health medicines which are out of stock. The money provided for medicines is generally less than what is required because of budget constraints. So it is not only mental health medicines, it is all medicines. But that will not make us give up. We have to continue to lobby so that even if medicines were to be out of stock, at least the mental health medicines should be available, because most of the people with mental illness are disadvantaged and they may not be able to buy medicines if they do not get it from the health facility. Government supports user groups. That's why you have them in our policy. That's why you have them in our strategic plan. That's why we encourage our health workers to assist users to form support groups. But the best way to develop somebody is to empower them. So the government policy is that we should mobilize users, educate them to understand their conditions, educate them on government policies and their rights, and that will empower them to demand for accountability, to demand for services. Because there is this saying that instead of giving a man a fish to eat, give them the hook to go and continue fishing, teach them how to fish so that they can continue sustaining themselves. We have examples in countries actually who give welfare money. What happens, these patients actually choose never to recover because they give money when you are in relapse. When you are recovered, then they say go and work. But because the mental health users are now confused by this money which is given, understand some of them at some point refuse to take medicine so that they may relapse and get the money, and they become now the earners for the whole family. Then another thing is that some of them provide for them homes, a halfway house or a home where they should stay. So they end up having all the mentally ill people staying together, and I don't think that is the right environment, because right from when, after the World Report of 2001, it was agreed that we should treat people with mental illness to recover and go back to their environment and look after themselves and also contribute to national building. Something we have seen, there are many mental health users who have recovered, they are working and they are doing well. So our hope, our wish is to empower the people to access resources like other people do. If there is funding, government already has funding streams for the disabled, funding streams for women, funding streams through the agricultural programs, NADS and what. So if the patients are well and have recovered and know their rights, therefore can approach district leaders and advocate for their rights, then they can benefit from these programs. And this is more sustainable than the government giving you some token. Because even in the ministries, we get very little money. So if they are to give users, they'll give them just a token. And then it covers your eyes from seeing what you can do to earn as you are waiting for this paltry contribution. So we prefer, let's not maim our users by trying to give them those handouts, but empower them so that they can work and earn a living, look after other people and contribute to nation building.